How's the COVID problem affecting the NHS? Well, not great, I'm afraid. It is causing a surge of activity, mainly with people, many of them older, many of them with pre-existing conditions, coming to the emergency room and requiring admission for COVID. And there's not much we can do about that. It's consuming time, staff time, beds, and a small percentage of those patients need critical care. That means their lung function is compromised and they need ventilation or some other way of sustaining their oxygenation. And that takes resources. And the scenes you can see Italy are what could happen here. I like to think they won't happen in such a disastrous way because we're better organized. We've had more time to organize things. How bad could it get? So the predictions vary widely. Epidemiologists, the doctors that do predictions, and the Imperial College predictions 10 days ago were pretty dire. The worst case scenario, 500,000 deaths. The best case, 20,000 deaths. Huge difference between 20,000 and 500,000 people dying. Now, okay, a lot of those patients are going to have died anyway this year. If it was only 20,000, that's a relatively small percentage of the 620,000 people that will die, that are predicted to die anyway, COVID or not. But 500,000 is a huge number, and that could overwhelm the NHS. And at the moment, we simply don't know where we're going to be. There are all sorts of bizarre things. Germany has had a large number of cases, over 30,000 cases now, and yet very small numbers of deaths, and we don't understand why. Italy, same amount of numbers of cases as Germany, but a very high percentage of deaths, and we have no idea why this is. These are extraordinary times for healthcare, and we have to do extraordinary things. For cancer, and that's my specialty, the worry for patients is they're not going to complete their treatment. So what can we do? First of all, there are patients in whom it's better to delay treatment. It's safer for them because most cancer treatments, radiotherapy, chemotherapy, suppress the immune system and make them more susceptible to the virus and the effects on the virus on the lung. So that's one thing. But the second thing is, because we won't have the staff necessarily because of the illness, because the hospitals are full, we may want to cut back. The NHS may want to cut back. What's the solution? Well, we've got priority lists. That's sensible to do. But also, no one should suffer. We should be able to have the capacity. There are 3 private cancer networks out there. The Rutherford is one. And we're meeting today to try and work out a scheme. All these networks have NHS contracts for patients. So it's not a bureaucratic problem. The contracts are in place. We just need to increase the number of patients. Do it at the normal NHS prices and just let's move forward. I think it's so sad for people to think they're missing out on the chance of a long-term cure because of this blip, if you like, in healthcare resources. Together, we can develop schemes to get people through this. I'm really optimistic. We'll help the majority of cancer patients to get their normal care at the right time, maybe though in a different place.